your curiosity right.
Mad Bricks webcast,
Where the human spirit flies. Mad Bricks webcast. Where the human spirit flies.
Hey, welcome to the Mad Bricks webcast. This is Ramana Namaraju. I'm the host. Sorry about that. This coffee cup. So, we have Susan is a long day for her. She could not able to join today, but join Doctor. Today. I was associated with the Association of Black Cardiologists for a long time. The founders and Dr. Richard Allen Williams. I know him for a long time, and he's a close friend. Is coming on the show. His name is Dr. Randall Maxey. He's an institution himself. I'm going to explain to him a little bit more, but black health is one of the challenging is the race is important in the health side, because the genetic factors play a role. We don't know yet all complete, but a lot of this advocacy is important for that. So we have to find out what are the root causes of these problems, or lifestyle changes, or the other problems like genetic problems, or the precision medicine and new AI thing is coming up. So let me introduce my good friend, Dr. Randall Maxey. He is joining his, I met him a few times in Los Angeles. He's a very well accomplished doctor. He's an internist, he's a nephrologist. He practices lifestyle medicine. He is truly a innovator and vivid learner. He has a AI company, sir. Think about that. He's a age is number. That's what he defines. So he has a AI company. So let us invite Dr. Randall Maxey to the table. Dr. Maxey, welcome, sir.
Thank you very much. I appreciate the
So,
invitation to be here with you.
yeah, thank you so much. Let me ask you a question. Just give me your background. Where you did your MD, PhD? You have a long story. Just give us a little bit background for us.
Well, I initially went to Miami of Ohio University, then University of Cincinnati, where I completed a
You went to
Bachelor of
Miami.
Science
You went to Miami.
of Ohio in Oxford, Ohio.
Ohio. Okay.
And I left there and went to the University of Cincinnati College of Pharmacy, where I got a Bachelor of Science in Pharmacy. Then I went to Howard University and I attended the graduate school and got a
Yeah.
PhD, and I attended simultaneously the medical school and got an MD.
Okay.
And I
So
focused
that
in
when you moved, when did you
pharmacology
move to? Where did you move? When did you move to Los Angeles?
in 1979.
79. You started there. Okay. That's a big long journey.
Yeah,
So what were you doing? A private practice there, or what were you doing there?
I came. I
What
came to
was
be.
you did a
I came
PhD, MD, PhD program together? How? Where did you do your MD, PhD?
at Howard University in Washington D.C.
I didn't know that they have a combination program there. I didn't know that.
Yeah, I was the very first student in it.
Oh, your
I
first batch of
initiated the
the MD,
program.
PhD. I didn't know that they have a MD, PhD program. That's interesting.
Yes, yes. So I
Oh,
was the first one to graduate with that double degree in that program. Now it has many students in it.
yeah. I didn't know
I
that they have
graduated
MD,
in
PhD program.
1972.
I know the John Hopkins has it, but I didn't know that they have a MD PhD program. New York University has it. I didn't know that Harvard has it. That's a very historical black school, very well reputed school. Charles Drew. Do you know Dr. Charles Drew is from there, right?
Yes, he was. He was professor of surgery at Howard University.
Have you taken
But
classes with him? Have you taken
what,
any?
no, he was deceased by the time I got there.
Oh, God, there he was
I did
deceased.
not know him personally.
Okay. Um, so you moved to Los Angeles. Why did you move to Los Angeles all the way from there, the East Coast to West Coast?
Well, they offered me a job to be medical director of a hospital that a group of physicians were purchasing, and one of which was Richard Allen Williams.
Yeah.
And he was my biggest mentor. I published with him in the book of Black related diseases,
Yeah.
and he became my mentor for years and years. So I call him my teacher.
But he is a teacher for a lot of people. He is a teacher for a lot of people. He is one of the most respected doctor, and he is a teacher for all of us. Let me ask you. If you can turn off that phone for a few minutes, we can talk
I
and finish it up.
don't know right now.
Yeah.
It doesn't want to turn there. I got to turn it off now.
So
It's
you
off.
did an internal medicine and fellowship in nephrology, you did, right?
I did a fellowship in nephrology at downstate in Brooklyn, New York, and Kings County,
Okay. So
and
you did.
I
Then
became
you came
assistant
back.
professor of medicine at State University of New York Downstate Medical Center.
Okay. Now, did you practice internal medicine, nephrology? You're doing a primary care plus nephrology. You're practicing both, or
Yeah, I did both.
you did both. Okay. So you were practicing in Torrance. Where are you located? What part of Los Angeles you're
I,
practicing?
I'm currently in practice in Inglewood, California,
Inglewood,
but in
California.
past years I had about 6 offices in different communities: Torrance, Beverly Hills, Los Angeles, Torrance. So I've been all over.
Yeah. Did you any famous patients you had? Any? We don't want to talk about their living patients, but any famous people or your patients?
Quite a few, but of course I can't
You can't
discern who
discuss.
they
I
are.
understand.
Can't discuss that.
I imagine there are a lot of people there.
But
Uh,
many of them were stars of Motown.
Oh,
Some
really?
of them
Yeah.
were, some of them were movie stars, and
Yeah.
so
Dr.
I can't really.
Barry Gordy is the granddaughter was on my show. Is on my podcast actually.
Well, that's good. I
Yeah.
I've taken care of a lot of relatives of Barry Gordy and
Yeah. I'm pretty sure
a
you have
lot of
connected with a
his
lot of
people
celebrities.
saying things like "baby, baby."
Really, yeah.
You
Don't
make
want to
me
mention
feel
the.
so
I don't want
happy.
to do HIPAA laws violation here, but yeah, you did a legendary work with a lot of celebrities. Let me ask you a question: is it black health was the Dr. Richard Allen Williams was telling always there is a lot of mythology, there is a lot of myths about people in the black community about the health of the black effect. For example, the pain is they don't they can bear more pain is one of the myths that me and Dr. Richard Allen Williams talked about it. There's a lot of myths about black health for outsiders. Tell us a little bit what those myths are.
Some of the myths: the
Yes.
blacks cannot bear more pain. I'm scared of pain. I'm scared of needles.
Yeah.
I'm pretty black, and people like to put that on as a myth, as a
Is a
reason
myth.
to deny people the care they should have. I tell
Yeah.
you, black people, their pathophysiology of pain is the same as anybody else. I'm scared of a little needle. I can stick you, but I can't. I don't like to be stuck.
Yeah.
And they think that an aspirin will take care of a heart attack. Many times it doesn't.
But you have a Tuskegee experiment is a very profound effect on the black community. Yeah, they didn't trust the system itself, black health system. The healthcare system they didn't trust. So how do you change that vaccines and they convince them do the vaccines is not for there's a lot of challenges in that into the black patients to address that kind of a mistrust.
Yeah. So the way we address it and the way we started Black Health Trust, we want to make sure that we had trusted messengers,
Yeah.
people that have people skills, good bedside commitment to people, talking. You don't talk in just highfalutin medical language, but you have to be able to talk the language of the people. And we know that you have to meet people where they are. We don't shame people. We don't make fun of their fears, and we present evidence-based medicine.
Yeah.
When we don't know, we say we don't know, but we'll find out.
Yeah.
But for the past 5.5 years, we've presented shows on the Black Health Trust to educate people to get their vaccines. help them understand what these RNA viruses are, what the vaccines are, etc. And like one way we described it is they made it by 3D printing. It's not really a killed virus like an old virus might be, but really a 3D copy that has part of the spike that will actually generate an immune response. And we try to put it in everyday language. And but trusted messenger, we have a loyal audience that follows us for the past 5.5 years.
Can you give
Some
me one
people,
example, one person name? Trusted, you're the trusted messenger. What is trusted messenger's qualifications? Doctors or political leaders
we've had
or the
doctors,
community
we've had
leaders?
nurses, we've had engineers, we've had college presidents, we had people from NIH, head of each division of NIH. We've had international people on, but we vet people first. We vet them before we put them on Black Health Trust. And we had a really good lecture this last week from a dentist who does preventative dentistry, who taught us how to determine based on the bacteria found in tooth decay and gum decay what diseases you might be liable to have
Yeah.
and how to prevent those. Many people don't think oral health or your teeth has anything to do with your dementia or psychosis. We know that the gut and the microbiome is very important to what goes on with your brain. So we've tried to expose our people to all of those factors, and we're archived on YouTube for the past 5.5 years.
Let us talk about gut health a little bit. So, what did you find in the is there any difference between the races and the gut health? Indians and black people and white people and Chinese. Is there any differences in the gut health wise
Well,
microbiome composition?
not, but it's based on what you eat. And we know
Mm,
that the microbiome is bacteria, that they're good bacteria and bad bacteria, right?
yeah.
And they have an effect on invading the walls of the gut, and they produce hormones, etc. And they many times determine your mood, your thoughts. Actually, there's a gut brain axis that's there, and it affects how you absorb certain foods. Now, how you eat, and nowadays we advise people to eat a primarily plant-based diet. You don't have to be a vegetarian. You can eat fish. You can eat some meat, but we know that has an effect on your mood. That's why many of the psychoactive drugs affect uh, what's going on in the gut, like serotonin, which is a hormone, but that affects your mood. Many of our drugs are devised upon that. But your microbiome and what you eat has a main effect on how your mood is, how your spirit is, and how you think. Very
So
important.
let us talk about the diet. We are. I'm from India. I married upon from a black American woman. She doesn't eat, but at her hometown, when I go there, they eat a lot of pork and beef and a lot of meat. Your plant diet, your proposing a plant diet for them is like a foreign language to the plant diet is. So how do you convince them? The black community to go for more of a plant based diet.
Well, it's difficult sometimes. It was
It
difficult
is.
for me. I was brought up eating meat, but we know that sometimes eating meat, which has certain types of saturated fats, can help cause insulin resistance, which can lead to type 2 diabetes. And it does so at a cellular level. And we now know that, for example, there's screening we advise people with looking not only for LDL, HDL, and triglycerides, but looking for LP little a, which is genetic. And we know that independent of what you eat, it can be affected by your genes. We know that some of the kidney disease is affected by something called APLO1,
Mm.
especially if you have ancestry from West Africa. You notice Europeans don't have that because this was done 10,000 years ago, where a genetic variant was made to protect people against a tsetse fly. Uh, so as many as 12% of U.S. blacks, Caribbean blacks, have these alleles, which allow them to have kidney disease. And that's one of the reasons kidney disease is so prevalent in black people. But interestingly enough, you have to have two of those alleles in order to have the kidney disease. And that can happen if you have what's called a second hit. If you have something like HIV, diabetes, hypertension. So all of these things are interrelated, and you can't always tell whether it's a genetic base, whether it's a diet base, or a combination of the two, or how your lifestyle is.
So the kidney disease is genetic based. You're saying it's also part of the genetic basis there in the kidney disease.
Yes.
Oh, good. I'm not good means in the sense that I didn't know that the kidney also. I know the diabetes is as a. One of the things is that. So you're saying that by diet it can trigger the second one, and the same thing happened to sickle cell anemia, right? So the Dr. Robert Pearl was talking about the sickle cell anemia. One of the gene was the gene factor was is actually protect sickle cell anemia to protect the malaria, but actually that caused the sickle cell anemia. It's a very interesting story. That can you help us? Can you tell us a little bit about that?
Well, what happens if you have sickle cell anemia, and it's not only in blacks, but it's a form of thalassemia and occurs in Ashkenazi Jews and other groups. Some of the Eastern European people who are more dark skinned, and many of them carry a similar gene, whether it's thalassemia B, sickle cell anemia. And what happens if the oxygen tension is low or there's stress on that person, the sickle cells form and they clog up the blood vessels and cause severe pain, ischemia. They can lead to ischemia in the femoral heads, and you can have bone marrow involvement. And many of these people can have strokes. Somebody can have kidney failure based upon these abnormal blood cells circulating and blocking up these very small blood vessels and capillaries when they're sickle. Now I think there's some cures. They used to use urea, but now some gentleman actually in Northern California, near Silicon Valley, where you live, has a product. He developed a drug company just sold for like $5.5 billion. His name is Dr. Love, and
Oh
they have
yeah,
found
Ted Lowe, Dr. Ted Lowe. Yeah,
yeah. So they have found a treatment for that's very valid for anemia.
I'd
And
love to have
I'm
him
looking.
on my podcast. Tell him please if you know him very well.
Okay, when I get a hold
So
of him, I'll tell him to call you as well.
yeah, yes, sir. Let me ask you that that kidney health is the biggest topic among the black community. This is hypertension is connected with it. Why there is an hypertension? Is it a genetic reason or mixed combination? Tell us why hypertension became a very prominent chronic disease among the black community.
Well, hypertension is a problem not only among the blacks,
It's all
it's a problem in general. And what
yeah,
we found recently is that there's a connection between the heart, the kidney, and the brain and the
yeah.
metabolism. And now they call it cardiometabolic kidney disease. And you have to treat all three. And it's been shown, especially with the new guidelines that just came out from the hypertension societies, that it can give you an increase in the disparities that happen with your brain with dementia. It can cause heart attacks. It can cause vascular disease. It can cause a genetic, I mean, not genetic, but metabolic abnormality. So you have to treat all of them, all of those diseases together. It's one big disease, not just separate hypertension. And the bad thing about hypertension is a lot of people have it and don't know they have it. And I get a lot of patients that come from certain hospitals around where the doctors are not attuned to high blood pressure. They say, oh, it's okay for your blood pressure to be 150 over 90. No, it's not. The definition of hypertension is anything over 120 over 80. And it's shown that even if it's 130 over 80, that your risk for strokes, heart attacks, and other problems, kidney disease, increase almost geometrically just having high blood pressure. And you can't feel high blood pressure. You don't have to have a headache. You don't have to know that you have high blood pressure. You know it by taking a blood pressure test with a blood pressure cuff on your arm. So it's very important that you
But
keep
the
your blood
measurements
pressure.
in Europe, England has a different kind of a standards for the blood pressure, right? And different
Well, no,
countries
I
have a
think that
different.
the standards, the Europeans are now leading. The U.S. they all have the same standards
Same standards
and
now. Okay,
same
they
standards.
had it before. Before they had different standards.
Yeah,
They're
but
doing that.
before that, but now I think they're coming to agreement that blood pressure is should be under 120 over 80, and
Mm.
we find out that as you get older, uh, like me, you tend to have systolic hypertension, meaning what causes blood pressure elevation is a stiffness of your blood vessels. When you're
Mm.
young in your teenage years and maybe 20s, your blood pressure is elevated because it has diastolic hypertension. So you can have both, but the one that's most prevalent as you get older is called systolic hypertension. And when you look at hypertension, it's the top number that is systolic, the bottom number in the measurement is diastolic. So
Let
the
us talk
stiffer
about metabolic health. And now everybody is talking about metabolic health nowadays. What do you think of what is that metabolic health? Tell us what are the indicators, the overall indicators of the metabolic health.
well, metabolic health for a lot of people, one of the biggest issues is diabetes.
Yeah,
And diabetes is based upon what's called insulin resistance.
yeah.
And it has to do with abnormalities of the way that your pancreas works. There's a hormone in your liver called glucagon that sometimes may be out of balance. And a lot of things can cause that metabolic balance to be very different. And how you eat controls a lot of that. And a lot of people now, for example, was a gentleman earlier that has started fasting. He's a diabetic, but he started doing intermittent fasting. And now his blood glucose stays around 96 to 100. That's perfect.
Mm.
So we don't have to be diabetic if we eat right and if we
Yeah.
exercise. And we talk about lifestyle medicine, so we say that people should make sure they exercise 150 minutes per week. And the exercise should consist of not only cardiovascular, where you're walking, increasing your heart rate, but also that you do some resistance or weights at least 2 days a week. And I know I try to work out as much as I can every few days.
I
And
don't want to ask you how old are you if you don't mind asking you.
I'm 83, almost 84.
83. Oh my God, you're 83 years young. You can teach us all of us what the lifestyle should be. So that you were always watching about what you eat. That is the most important one. I think you thought about it.
I haven't always watched what I
Are you
eat.
vegetarian? Are you vegetarian, Doctor Maxey? Are
I'm
you
not.
vegetarian?
I'm
Huh?
not. I'm a minimal meat eater. I eat plant based most of the time. I eat fish. My family is vegetarian. My daughter and my wife are both pescatarian. They eat a lot of fish. So rarely do I eat beef in my house. Every now and then I may eat a piece of steak.
Okay.
Rarely.
Yeah.
But I grew up in a household we didn't know that back in the day in the 40s and the 50s.
Yeah. That's it.
So I used to eat a lot of pork, a lot of
A lot of
bacon,
pork. Yeah.
chops. I try not to do that anymore.
Yeah.
But
Yeah. You can. That you are the best testament for that. You're doing good.
yeah,
Let me ask you this new GLP-1 drugs. My co-host asked me to ask you that GLP-1 drugs that what is that called? New
Ozempic.
drug, Ozempic and Wegovy or something like that. These are all. Are they receptors? What is the special about it? Are they really changing the scene of the metabolic health in general? They're addressing the cause of the problems.
I think they are. So a
Really?
lot of people are overweight, and the drugs were initially looked at for being overweight. And a lot of people need to reduce some of the weight, especially when they have fat around their heart, fat around their internal organs. But it was
Yeah.
found that by doing that, they also reduced their cardiovascular risk, their stroke risk went
Yeah.
down. And the way it works in renal disease, for those who have something called chronic kidney disease, which means you've had some kidney dysfunction for more than 3 months, it allows you to urinate out or pee out a lot of the excess glucose. And that helps bring your diabetes into order. But I also, along with the GLP 1s, use a cocktail. And that cocktail consists of the SGTL2s, or the drugs like Farxiga. And that does somewhat the same thing as does the Wegovy and the other
Ozempic.
medicines like that. It allows you to urinate out more of that glucose
Oh,
and regulates your diabetes more, and also uh, cuts your diet somewhat. Uh, and part of the way that SGLT ones work is they increase your or decrease the way that your stomach gets
so
rid of
suppress
food.
the hunger gene or
Yeah, it
something like
makes
that.
you feel
Suppress the
full.
hunger.
It makes you feel full.
Full. Yeah, that's what I
Okay.
heard.
And then there's a third one,
Hmm.
and that's called something that what makes your kidneys scar, what makes kidney disease is inflammation. So we have a drug called Corindia, which is phenonarone, and phenonarone uh, affects to stop the scarring in your kidney, mainly from hormones emitted by your adrenal gland.
Hmm.
So we use the SGLP ones, the SGT2 inhibitors, and the drugs that also help relieve the inflammation and scarring in your kidneys. And many times we can reverse some of that, or at least stop it, slow it down, so you don't have to go to either transplant or dialysis. So it's important to use all three. But the basis of those three, then you have to put the RAS, or the drugs like losartan, the angiotensin receptor blocking agents, or the ACE inhibitors. And those are foundational. Add that to appropriate eating and exercise, and that's the way we had to approach all of them.
So these are all combination of cardio, heart and kidney and all the other organ. A combination of cardio pharmacology. You're doing it. It's all connected together. Kidney, heart, and the stomach and all the internal organs are connected together, right?
They are. Well, yeah, if you notice, there's I don't, in the Christian Bible, it talks about the neck bone connected to the backbone, connected to the ankle bone. Everything, you're one body. You got different organs and different arms and legs, they're all connected. And bad health in any one of them is going to affect health in another arm. So it's not just separate things. So it's body, mind, and soul is very important.
Yeah. So let us talk about soul, body and mind and soul. The prayer. People go to churches, people go to prayers, that some of them are really that gives them a lot of strength and belief, and it gives you mental health, and there's a lot of churches are to tell us a little bit the role of a black churches, and then the role of that mental health is connected together.
Well, when you have faith and belief, whether it's in Buddha, whether it's in Christ, whether it's in whatever form that you worship, it creates a sense of peace in you, and you generate mental hormones that give you peace. And they have, for example, and I don't want to go too far on it, but you know that the brain makes something like the cannabinoids. And cannabinoids you've heard of in marijuana.
Yeah,
Brain makes its own marijuana when you feel good. They're called endorphins,
endorphins.
and that
Yeah,
peace can come from whatever. I know in in your country, in India, they have people who are Brahmins, right?
yeah. I'm a
And
Brahmin. Yeah.
okay, and there's certain peace that you get from that. That makes you have certain endorphins in your brain that give you peace.
Peace.
I
Yeah.
believe in Christ. That gives me something to believe in, and that makes my endorphins go. So, whatever makes you tick gives you peace and faith. That helps your health in general.
Yeah. feel joy, right? Is a feeling joy hormone, right?
Yes.
That is a powerful feeling joy hormone.
So you also get endorphins when you walk, when you work out,
Mm.
and that's a good part of your mental health and physical health as well. So we can't separate out the different aspects of health; they're all joined together.
Mm. Absolutely. So, to tell us a little bit, you're 83 years old, but you're embracing artificial intelligence. That surprised me a little bit. Tell me, even in Silicon Valley, young people are scared of AI. You were ahead of it. Tell us a little bit of AI. You start a company called, what is the name of the company? We wrote it down there. DRA,
It's
help, AI.
yeah,
Yeah.
drehealth.com. I didn't invent it, but the gentleman that put it together actually is a country mate of yours. He's both a space engineer. He developed the Iron Dome that's over Israel and has been working with the U.S. to develop a similar thing here. But he's a lawyer, so his company had a group called secondopinion.com, and we did a relationship a few years ago where we have second opinion medicine through him with drehealth.com. I'm one of their associate medical directors on that. And what it is, it attaches, if you send in your medical history and fill out the forms and put in your medical record, it will generate a generative AI opinion, second opinion, which your doctor can review and help you out on that. And that's being launched already as of this month. And we're looking for people. There's two versions of it. There's one for the patients, that's called Hey Dre, and there's one for the doctors, that's drehealth.com. And I've put in a lot of my patients on that to help with the diagnosis and differential. Because if you haven't considered everything, then you're behind the eight ball.
Did
We
you
need to
find that
consider.
anything special? Did you find anything because of your putting in the AI? Did you find anything special so far?
I wouldn't say special, but sometimes when the person puts in their ethnic background, what they do they smoke, what do they eat, you can come with a lot of variables. And AI it can put that together much quicker than your human brain can. You still have to review it and look at it because AI can make mistakes itself. It's not perfect, but allows you to review a breadth and depth of data that's vetted in the journals, National Library of Medicine, and give you a leg up on what's happening. Many things you might not have thought about.
Hmm.
So it's not perfect, but it gives you an idea of what's happening. Now, we know that there's a lot of wrong information in the literature. So we've tried to hook this to the information that we gather in the National Medical Association and journals that look at ethnic background. We know there's no such thing as race, right? That's the social construct. But your ethnic background, many people now are looking at something called uh, personal or personal health. I can't judge your body by somebody else's. I have to tailor what I think and what I treat to you as an individual. We have a lot of people that are mixed race. How do you know who's what anymore? So I think Dre Health is going to make changes in a lot of ways. People we practice medicine and we do better. Can you still hear me? I don't hear your voice anymore.
Can you hear me now?
I can, yes.
Yes. So let me ask you a question. You just mentioned about space engineer did the AI. So I'm going to talk about space. If you don't mind, I will present a small topic on the space medicine. Okay, if you
Okay.
don't mind, and then you are free to comment on anything else on that one. Let me add the scene there. Yeah. Yeah, this is the scene media. I'm going to talk about the. I love space. I'm a physicist. I'm not a doctor, but space science is my favorite subject. You just let me bring you on the side. Yeah, let me bring you on the side. Yes, exploring space, Dr. Maxey. Watch this: exploring space, enhancing life, physical, mental, social, spiritual health. How the space is helping us. NASA, then the USA, Indian space agencies, Japanese space agencies, Russian space agencies. They're all helping human health. How they're helping, I wanted to just talk about that a little bit quick. This is a the space radiation is more of a physics. I'm not a doctor, but I'm going to talk about physics part of it. So it affects the damage. DNA is a DNA damage. It does. How does it do? It knocks out the electrons on the atoms. It knocks out the electrons. That's called ionization. So that's where the problem starts. You get the DNA. You get a bone loss. People get shortened out. Actually, they become smaller. Mental health problems, serious mental health problems, cancers, gut health. GI cancer is one of the prominent cancers from the space radiation. When you are in the space, extreme weather, when you are in space, these are all problem from space. When you are when you do space travel, in the satellites or anything, if you go to the moon, for example, or to the Mars. Wound healing is a big problem. When there is a serious problem is when you have a wounds, it is not doesn't heal that fast. The reason is you get a lot of cancer. I tell you about the cancers, why you get gut cancer, GI cancers more with that one. Wound healing is another problem, because wound healing is that, because the gravity is less, so most of the blood and everything doesn't come outside. Most of them go to the top of the head. So skin causes a lot of problems, aberrations and all those things. So they can be cause of birth defects. These are the things that cause the space radiation. So what is the there's a Van Allen, the Professor Van Allen is a physicist. He found out the Van Allen belt, cosmic radiation on the top of the Earth's atmosphere. It is actually protects us from solar winds and our ozone layer, all the ultraviolet, which we are protected. Earth is by default protected by these outside belts. So we are lucky. That's why we are here. So what is ionization? Is what it does is when you are exposed to the radiation, it knocks out the electrons in the atoms. That's a part of the molecule. The atoms are part of the electro, electrons are part of the atom. Atom is a molecules. Atoms are the part of the molecules. So it knocks out all electrons that causes the ionization, the damage to DNA. So there is a gut cancer. There is a GI cancer is a very prevalent in space. One of the reason was, I didn't know this, was I was learning that you can comment on it, Dr. Max, if you, for gut lining, all the stomach lining, every 3 to 5 days it changes. So that process goes slow down in the space. So they are much more they're prone to the cancer. They found out, Alfred Fornes lab found out of the NASA is one of the most prominent cancers from the GI cancer, is one of the high risk in the space radiation problems. Then the other one is oncology, the cancer. Cardiology is we are going to talk about, actually heart rate variability came from space. They actually came from a Russian Mir space lab. Mir space found out that's a cardiology. They found out neurology. There is a neurofeedback. People get lonely in the only small container. They're there in the space. Mental health is a big psychiatry. These things are affected by. So these are all. There is a lot of things coming from space. space investment is a good one. Diagnostics and therapeutic devices, space medicine, pharmaceuticals, and photoceuticals is a new kind of thing. I'm going to explain to you what the photoceuticals are. Pharmaceuticals, new drugs coming out of space. So one of the things is that Dr. Niels Finsen, he is a Denmark physicist, got it. He's a physicist, a doctor, a medical doctor, and a physicist. He got the Nobel Prize for found out that the light therapy, light can heal some wounds, light can heal some diseases. Light therapy. So actually, Tina Karu is another Russian scientist. Found out about that. Is a Ron Ignatius is a guy in Wisconsin. He was what he did was he was experimenting on the music and vegetation station in the space. How do you put the vegetations? He was stimulating with the LED lights. What he found out was LED lights are stimulating the growth of the plants. Not only is the growth of the plants, Dr. Maxey, it is also healing. People are getting cuts from the vegetable that's plants. Their healing hands are healing much faster because of
Mhm.
LED lights. That was a surprise result from the NASA studies. So is a light therapy came out of that process. So is a light is healing, LED lights are healing the wounds much faster. They found out through the NASA space agency's funding study in Wisconsin. So that's a company called Multi Radiance now. It is actually they sell reduces oxidation stress on the cells, free radicals, antioxidants. So this is actually light therapy. You can buy it now. Multi Radiance, a company, they do sell these things. Humans, so radiant is a photoceuticals. You can do the light therapy, red light therapy. They call a lot of people offer red light therapy. So that is came from space. So you have fibromyalgia superpulsar laser technology came from this thing. So they use lights through pulses. Laser is a light. They give these pulses, and then they can treat the fibromyalgia, pains, all those things through the space agency inventions. So space investment is not waste. It produces a lot of new things. So another podophrine. This is another thing is interesting. Photoceuticals they are called photodynamic therapy. This is what do you do is you give a photo light sensitive drugs to kill cancer cells. You know that the oxygen deprived oxygen. So these are photoceuticals. What they do is they send it to the attached to the cancer cell, and then immediately you can blast them off with the light and the blow up. So photoprin is a light sensitive medicine. Is a light sensitive particle. So it is immediately it responds to the when you have lights, it immediately reacts it and then blows it up the cancer cell. So that is a the photoceuticals they call. They have a photoceutical they call. So photoceuticals are light ceuticals. The photons are the therapy. So out of the NASA spin, menopausal women get these new clothes. What the gloves from the gloves they use in space. The new clothes came out because the temperature of the menopause. I didn't know that menopause has a temperature very very hot flashes they call chills and night sweats for the menopausal effects. They are manufacturing these clothes based on the technology from space. So there are actually you can buy them now. Now more than 1 million, they can buy them in the 50 shades of clothes they call. So you can buy actually. Uh, you can just a minute. You can buy these clothes from there. So almost I'm done. So these are high tech fabrics you can buy. 51apparel.com. All the people with the menopausal problem you can buy. Actually, she's a is a spin-off company from the NASA actually. So then, so the next one is there's a strip test came of shingles. Strip test came from NASA, from space agencies. Shingles test, you can do strip test. Then moon image processing, we do radiology, MRI. We were the Pasadena, where the Dr. Maxey is, that where they do the moon pictures of image processing. The software they developed there, you can use in the medical side. You can get a very clear pictures. They clean up the images and all those things came from there. All the DICOM images and everything you see came from the invention of the NASA space. It vertigo balance test, for example, came from Mir space station, Russian space station. Found out because in the space you do orientation is the problem, right? So when you have a middle ear defects or the imbalance, that vertigo imbalance, you can find that you train them how to do balance out through the balance thing. So that's a vertigo. It came from the space. Russian space agency it came from. Brain training, neurofeedback. This is a attention span is clear of focus, because so many instruments in the space for these ISS, International Space Station. They have a lot of instruments. You can do that through this process. The brain train, you can do the neurofeedback, so you can increase the focus through this. They found out that from there, it is one of the most powerful device came out of the space. The pharmaceutical, the pharma, one of the most powerful drug is a monoclonal antibody, is a guided missile. Is basically it kills all the cancer cells. Pretending cancers are bad actors. Some cancer cells hide; they act like normal cells. But the Keytruda, they find out. But this is done in the space, because Keytruda, because we have a gravity, it is a flat here. The problem is all the Keytruda, it becomes a two-dimensional. You can create a molecule three-dimensional in the space. So Keytruda is actually a lot of research came from so tumor genetics is before the tumor genetics is born from the Keytruda. You're not treating the tumor causing that bad actors. You can find them and kill them through the Keytruda. It's a powerful new kind of technology, new kind of a science from space. Osteoporosis, there's a Prolia drug came from osteoporosis from space. Allergy medicine, for example, epinephrine came from the auto injector. Is allergy that it came from the space station inventions. Wound care, now new patches coming up, a lot of patches, extraordinary patches, because they use electricity to treat.
So this is fascinating what you're talking about. But I think if we think back, what is space? And we know that living on Earth, our atmosphere protects us from a lot of the radiation. We know that the sun and every star there is a nuclear engine, and that engine is the source of our energy and a lot of things that happen here. So it's no surprising that NASA's space agency, the Russian space agency, the Chinese and the Japanese and Indians have found out a lot of things by venturing into space. But this just fits in that we are creatures created from space by whatever God you believe in. I believe in Jesus Christ, and was spoken by the Word. And we know that light and sound are both not just energy, but they are physical. They have weight, they have mass, and according to your relationship with your local star, it affects your energy. So these are very interesting things. We know that because of NASA, our science did take a leap,
Yes, sir.
but our atmosphere, and we know there are probably billions of other Earth-like places where people that are made like us can survive. Maybe there are other people who they may breathe carbon dioxide, not oxygen.
Yeah,
So you
there are
can't say,
people maybe aliens. That's the carbon dioxide. They're
yeah.
we don't know. This is a lot of things are there. So the space, you eloquently said, space gives us sound, light. These are all something that is real. They give the life to us. There is a lot more meaning to them, and we need to explore that. The space is a excellent exploration place, right?
Hmm.
Yeah, that is all the drugs came out of this place. Then there is a shelf usage. One of the thing is shelf life. They're finding out the biggest challenge in the shelf life in this space. That's why they're now new finding out the shelf life, increase the shelf life through the space agency, new things. But I'm going to finish up soon. They do surgeries in this space because if they have a long, if then eventually we go to the other stars, it may take 50 years or 60 years. So you need a surgeries to learn how to do surgeries in this. So they do surgeries in the space. Burial ground, I don't know, burial manual is there. I don't think we don't know about it because they drop them in the space. I think that's all it is they can do. So pain, sleep, cold medicines, birth control pills, they all take it to the space. When the people are traveling to the space, they take a pain medicine, sleep medicine, cold medicine. They all take that. They all take that. That's one of the things they do. So space is a cost. Space suit costs about $42 million. Okay, each one. Space is a completely silent. There is no sounds. The sun's mass takes 99.96% of the solar system. That is the solar system. 1 million Earths can fit into the sun. Can you believe that, Dr. Maxey?
Oh,
1
yes.
million Earths can fit in the sun. So microgravity. So it's a very interesting thing in space. Telemedicine came from NASA. Disease models are coming up. Psychological test response. We are testing nutrition, cell behavior. All of them are new things coming up from the space. UCLA, where Dr. Maxey is there. Mayo Clinic, NASA. They have a fellowship actually, space fellowship, space medicine fellowship. You can do that. So 2 year fellowship in space medicine for doctors. Anybody is interested in going there. Is African American woman, Dr. May Jamison. Do you know her, Dr. Randall Maxey?
I've talked to her before. I don't know her personally, though.
She went to the space. She is a doctor.
She's the first
So where no
black
man
woman
has gone
astronaut doctor.
before, the doctor has gone. She is she is a shining light for all of us, humanity. Space is a big place to exploration. We still will know a lot about space. Thank you for watching. Let me bring Dr. Maxey back to the stage and let me ask him, what do you think about it? What do you think, space agency, space for us, Dr. Maxey?
I think that is so much of our rapid advance over the past 50 years has come out of NASA. And we're finding out that it's relevant to everything that we do today. And what you presented was a good summary of how they have contributed to modern medicine and many things that people don't yet accept yet. But I like your information on light, LEDs, and photo pharmaceuticals, and those are things that we're getting into now. And
Yeah,
like brain feedback and brain mapping,
yeah.
uh, which are all things that we do now to
They,
look at
people
ourselves.
don't trust it for a while because now we know that came from space. That is a phototherapy. I did not, to be honest with you, I thought it's a cuckoo, this phototherapy is, but now I believe the space agency gave us a science, gives us the valid platform for that. So it's a lot of people we thought that what is science, we have to follow science, right?
That's true. But let me ask you a question about me. Let me flip the script on you. Do you believe that human beings on Earth are the only intelligent beings in the universe?
No, absolutely not, because life is just a very. These are common elements we have. We are not rare elements. Carbon, hydrogen, oxygen, all over the universe, right? So if we are not this our composition is not uncommon. It's everywhere in the universe. So I think that we are We are intelligence life is everywhere.
Yeah. So I read a lot of what's called science fiction, but I believe it's actually true. It's not fiction. We just haven't been exposed to it yet. We haven't found it yet. But I believe that there are many intelligent species in the universe.
We are
We just
coming to close, ATL Atlas, that's something new one is coming up. There's a lot of anomalies we are seeing already. The Israeli Space Agency had recently he gave a interview. He said that we are talking with the aliens already. That's what he says. The governments are already talking because we are not intelligent enough to understand them. They let you
mm,
go through our process. Like you're talking with a cat, quantum physics. So they can't talk with us at this time until we evolve into superior human beings.
and a lot of people believe that there are many dimensions in life, not just the three that we're aware of: height, space, and width. But
Yes, sir.
and things that might happen simultaneously that we just are not intelligent enough to perceive. But as we develop, we'll come to it, and eventually we'll have a known encounter. And some of these things will be explained to us when it's time for us to learn them. We're not we do so much harm to ourselves
Yeah.
with all these wars, and
Wars are nonsense. Yeah.
that's
Dr.
not good.
Yeah, not good. Dr. Maxey, you are a prime example of how to live good life and how to curious mind at any age, at any time. You are a best demonstration of that. You are all teachers to all of us. Age is a number. We all can live with that. And you are curious even today. And you are with the AI. You're talking about space science. It's an amazing for me how that is. You're not only for your prime example for every human, all the people, not irrespective of the race. You are a true example of that science is you were showing the faith and science then can go together. You are the best example. Thank you, sir, for coming on the show.
Thanks so much for having me. I enjoyed myself. This is great. I enjoyed your lecture on space.
Thank you, sir. It's truly an honor, privilege to have you. Thank you. Good night, all of you. So
We are retelling their stories through our patented designs that can be worn on scrubs, t-shirts, printed on conference bags, and endless other promotional materials. Daily Wear for Medicine is the first ever of its kind to create curiosity in medicine through visual art. We at MedBricks are celebrating unsung heroes of the past who made enormous contributions to the field of medicine through our unique campaign called Daily Wear for Medicine. You can wear it, carry it, and give it.